Welcome to OET Answers.
Please start the role play.
Thank you for giving me the opportunity to examine you, Patricia. I've just completed taking your vital signs. I understand that experiencing discomfort like this can be worrying. However, I want to reassure you that there's no need for immediate concern based on the vital signs. I have just taken vital signs such as your heart rate and blood pressure are stable, which indicates that your body is functioning normally. While I can't exactly tell you the cause of your earache, yet it's a positive sign that your overall health seems to be in good shape. Don't worry, Patricia. We will work together to address this issue and ensure you feel better soon.
Thank you, nurse. Your words are reassuring, but I've been having this terrible earache bothering me for a few days, and now I thought it would be best to get it checked out.
Patricia, I truly empathize with what you're going through. I appreciate your proactive approach to seeking medical attention for your earache, since I can't fully assess your condition with just some initial observations. It is crucial to undergo a thorough evaluation by the doctor. Your doctor can conduct further examinations to identify the underlying cause of your discomfort and ensure effective resolution as soon as possible by scheduling an appointment with the doctor. We can thoroughly investigate your symptoms and rule out any potential underlying conditions. Please know that we're fully committed to supporting you every step of the way in finding relief from this earache.
Okay, that sounds reasonable. May I know what are the next steps, then?
Of course, Patricia. Following our discussion, the next step is to proceed with scheduling an appointment for you to see the doctor. Once the appointment is arranged, you can go back to the waiting area where you can comfortably wait until it's your turn to be seen. And when your appointment time arrives, you will be guided to the examination room, where the doctor will conduct a thorough examination to assess your earache and determine the appropriate course of action. This may involve further tests or discussions about treatment options depending on what the doctor finds. Now, before we finalize the appointment, do you have any questions or concerns about the process or your condition? Your comfort and understanding are important to us, so please feel free to share any thoughts you may have.
I understand the process. I was wondering what could be the reason for this earache. What do you think about it, nurse? I mean, any initial thoughts or guesses?
It's natural to be curious about the possible causes of your earache, Patricia. However, it's important to remember that I'm not qualified to give a definitive diagnosis. Earaches can be caused by various factors, and determining the exact cause requires a thorough examination by the doctor. They have the expertise and tools necessary to provide an accurate diagnosis. During your examination, the doctor will carefully assess your symptoms and determine the underlying cause of your discomfort. From there, they can recommend the most appropriate treatment to alleviate your earache effectively.
Thank you for explaining that, nurse. I understand the importance of getting a proper diagnosis from the doctor.
Perfect. Before we proceed, Patricia, may I have your consent to book an appointment for you to see the doctor regarding your earache?
Yes, absolutely, nurse. Please go ahead and schedule the appointment for me.
I appreciate your decision. Well, Patricia, before concluding, let me summarize what we have discussed so far. I have examined you, and your vital signs indicate that your body is functioning normally. While I cannot determine the exact cause of your earache, I emphasize the importance of a thorough evaluation by the doctor to identify the underlying cause of your discomfort. I outline the next steps of the treatment process, including scheduling an appointment with the doctor to thoroughly investigate your symptoms and ensure effective resolution. Also, I explained why I cannot provide a prognosis. And then you agreed to schedule your appointment. Patricia, if you need anything else in the meantime, feel free to ask.
Thank you, Nurse Andrew. That is the end of your only speaking roleplay. All the best.
Thank you.
Thank you for watching. Kindly comment your suggestions and help us do better.